A very good morning to all of you. Uh, a disease so deadly and so rampant that it has a dedicated specialty in allopathic medicine, that is tuberculosis. And today I stand here to walk you through the global scenario for tuberculosis and a little bit about the World TB Day. So, so I'll be taking you through a bit of historical aspects, TB global scenario, including the national and in Maharashtra, and the World TB Day theme, and how we as medical college, all the functionaries in the medical college, how we can contribute to ending TB. So a recap of basic facts that we might be already knowing, that Mycobacterium tuberculosis is a facultative intracellular bacillus resistant to intracellular killing. Atypical bacteria are on the rise, but the Indian TB bacillus is less virulent than its European counterpart. One untreated TB case infects about 10 to 15 people annually who are susceptible. And moreover, in a household, if we have a TB patient, about 30 to 40% of household contacts get infected when there is one TB patient in the family. So that is a kind of a incubation, or that is a kind of a spread which can affect. So effective treatment reduces infectivity within 48 hours, which means that immediate treatment or putting the patient on prompt treatment is so essential to render them infectious free. Social factors influence occurrence and spread of TB. So TB is a social disease with medical aspects, and we need to remember that the social aspects, there are several social factors which go hand in hand with TB occurrence. Coming to the history, so TB dates back to almost 150 million years, they say. Ayurveda also mentions about TB as Ksha Roga, and the Ayurveda, the Charak Samhita mentions about the various types of fevers and even the types of coughs that can present in a Ksha Rogi. And white plague epidemic has been, it was there in 18th to 19th century, and in 1882 with Robert Koch discovering the TB bacillus, confirmed TB as an infectious disease and pioneered even modern TB treatment. So modern TB control involves tests and vaccination and even treatment strategies. So coming to the global burden of TB, so in TB we usually say incidence, that is the number of new cases occurring for every 1 lakh population. So currently there are about 10.7 million cases, which amounts to 131 TB cases per 1 lakh population, out of which 8.3 million cases are newly diagnosed and reported. That means out of the existing 10.7 million, we have been successfully diagnosed and reported 8.3 million, that is 78% of TB incidents. 1.23 million people have died due to TB, of which 1.8 million are non-HIV TB patients, whereas about 1.5 lakh HIV patients have succumbed to tuberculosis. When it comes to rapid testing coverage, 54% of the new TB diagnosis has been possible due to rapid testing methods like NAD. Then, when it comes to the multi-drug resistance and rifampicin resistant TB cases, about 390,000 TB cases are drug resistant, and of which 165,000, that is about 42% of TB, multi-drug resistant TB cases are put on treatment. So, which is also a cause for concern that ideally all the drug-resistant patients should be getting the treatment for obvious reasons. So when it comes to WHO regions, okay, there is Southeast Asia region, there is Western Pacific region, African region, region of Americas, European region, and Eastern Mediterranean. These are the WHO regions, and Southeast Asia region accounts to about 34% of the global TB cases, in which India contributes to majority of the TB cases, and the least number of cases are found in European region. So apart from being a diabetic capital, we are also a TB capital. So if we see the global TB burden, high TB burden countries, about 30 countries contribute to 87% of the global TB cases, and India accounts for about 25% of these cases, and Indonesia, China, Philippines, Pakistan, Nigeria, DPR, Congo, Bangladesh, they follow on. So it is concentrated in Asia and Africa, and high burden countries targeting is essential to end TB. When it comes to gender distribution, about 5.8 million cases are males, which is accounting 54% of the total population, total male population. 35% of women, that is 3.7 million cases, are existing in the women. 11% of children are affected by TB. So about 1.2 million cases of TB are in children. So we have something called as WHO NTB strategy from 2016 to 2035, and in this it was envisaged that by 2025 we will reduce the number of TB deaths by 75% as compared to the 2015 performance indicator. So compared to the performance observed in 2015, how much we should be progressing by 2025. So by 2025, we should reduce 75% of deaths, 50% of TB incidents, and 0% of TB affected households facing catastrophic costs. Which means that whenever a patient is suffering from TB, the TB patient, those patients who are, majority of the patients who belong to the poor socio-economic strata, they are pushed into more poverty because of the TB status or because of the TB disease as such. So we want this, so this is called as catastrophic cost. I mean the extra burden on their pockets is called catastrophic cost incurred by the patients, and this should be ideally zero at all times. So by 2025 or by 2035 even, it should be zero. So we should take care that all the services which are dedicated to TB control, they should be affordable, and mostly they are free. Majority of the patients or all of the patients who are in need of these services can avail them. So where are we today as far as this WHO NTB strategy is concerned? So as far as the incidence rate is concerned, we were to reach at 50% reduction. That was the target goal, but we have reached to up to 12% reduction. So which is okay, which is not a great success, but yes, we have at least put our steps towards reduction. The number of TB deaths to be reduced was 75%, and now we have reached to almost up to 30% reduction. And the catastrophic costs that were to be reduced was to be zero, but we have reached still 47% of the patients go into catastrophic cost, or they are pushed into poverty because of the extra costs of TB treatment. So we have a long way to go. So there is 88% treatment success rate in case of drug susceptible TB, 71% in MDR TB, and about 47%, as I said, TB affected household, they are still facing catastrophic costs. But people with TB, those who are covered with social benefits, like there is direct benefit transfer, like there is money given to the TB patients, and also there is something called as Nikshay Poshan Yojana, wherein we give additional nutrition support. So such kind of initiatives are to the tune of 44%. So in a household, as I said, that there will be household contacts who will be about 30 to 40% of the contacts will be at a risk of TB infection or getting TB from their TB relative. So they need to be put on something called as TB preventive therapy, TPT. So 5.3 million people were put on TPT, and this coverage in people living with HIV/AIDS was 58%, and coverage among the household contacts of people was 25%. So when it comes to household contacts, we have a very long way to go, because only 25% of the contacts are really put on TPT. Ideally, all should be put on. I mean, all those who are susceptible should be put on TPT. So there is also a provision for funding. Okay, so funding to aid for TB services, as well as for research and other innovative initiatives. So this aid needed is about 22 billion. Okay, and out of that, only 5.9 billion is being received for TB services, and a meager amount of 1.2 billion for TB research. So this also needs to scale up, and all the countries should kind of fill their treasury to provide for this funding. Coming to TB control in India, so this is the timeline for evolution of tuberculosis control in India. It began as a national tuberculosis control program in 1962. 1997, DOT strategy was started as a part of revised national tuberculosis control program, and this was extended to the whole country in 2005. In 2007, we had programmatic management of drug-resistant TB. 2012, we had TB notification, and a case-based notification system was started in 2012. So from 2012 to 2020, we have developed the standards of TB care, introduction of daily weight banned by FDCs, fixed dose combinations, in 2016, and new drugs like bedaquiline and delamanid in 2017 and 18 respectively. And in 2020, the program itself was ambitiously renamed as National Tuberculosis Elimination Program. And whatever we wanted to achieve in 2030, that the Indian national government decided to achieve even 5 years early, that is 2025. So far, we have not been able to achieve that, but yes, we have accelerated our efforts towards achieving that. So when it comes to the TB burden in India, we have 230. When it comes to 2015 parameters, there were 237 cases per lakh. Now we have reduced to 187 cases per lakh in 2024, and the total TB-related deaths have decreased from 28 deaths per lakh to 21 deaths per lakh. And as far as case detection has increased from 53% in 2015 to 92% in 2024. And when it comes to the numbers, over 24.5 lakh TB cases were detected, including 8.61 lakh asymptomatic cases. So this has just happened because of the intensified and active screening that has taken place as a part of various initiatives of TB control program, like the 100 days campaign or something. And what they have done is they have asked the 4 cardinal questions as a part of screening, and this itself has resulted in 8.61 lakh cases being diagnosed despite the session. Coming to the TB control in Maharashtra. So Maharashtra, amongst the Indian nation, has a high TB burden, is a high TB burden state in India, and about 12% of India's TB cases come from Maharashtra. About 2.19 lakh TB cases have been reported till 2025, and the incidence rate amounts to 153 cases per lakh population, as against the world average of 131 cases and national average of about 180 cases. So there is 27% of reduction in the incidence rate as compared to 2015. So it is a heartening thing, but yes, we have a long way to go. So the treatment success rate is to the tune of 88%. And despite the progress, Maharashtra remains among the top contributors. Hence, there is a requirement for intensified detection and prevention efforts under the National TB Elimination Program. So regarding NTR Nagar, notified TB cases as of March 2026 are 664. About 90% of TB cases were notified in 2025. And MDR cases were 42 who were notified, as well as all of them were put on treatment, which is 100% successful treatment for the MDR patients. And in the Nikshay Poshan Yojana, the TB cases were paid, about 1,590 cases were benefited from this Nikshay Poshan Yojana. Regarding the deaths, yeah. So in 2024, about 4,783 cases were notified, out of which 151 died, and death audit was conducted for all of them. And the major comorbidities were found to be respiratory failure, hypertension, diabetes, renal failure due to CKD, etc. So till Feb 2026, 6 deaths have occurred, and all have been audited. Coming to the World TB Day theme, today's very purpose for us gathering here. So this year's theme is Yes, We Can End TB, led by countries and powered by people, which means that there has to be leadership at every level, beginning with each country, and empowering the people to come forward and be a part of the progress and be a part of the initiatives taken for ending TB. So this is a bold call to action and a message of hope. Ending TB is thus not just aspirational, it is not just an ambition, but it is in fact an achievable feat, and we must also strive to achieve it. So there are some 6 key messages. So the first key message is make investing in TB a strategic political choice, which means that it has been observed that every dollar you invest in TB care, in TB services, you get a return of $43 back in terms of benefits or the health outcomes as such. So that much is the huge return that we get, and that's why we must strive to invest in TB care. The second key message is accelerate innovation to reach people faster. So we have AI-based X-rays. We have one vaccine in the 3rd phase of trial. So there are a lot of innovations being done, and all of this is to make sure that the people in need, those who are in need of TB, any kind of TB services, right from the detection to the prevention, they get these services at their footsteps and immediately when it is their need to get it. Then protect hard-won gains is the third message, which means that whatever efforts we take, they are likely to get disrupted, especially in situations like pandemic or in situations like currently we have war situation. So we have observed in the pandemic as well as now in the war kind of a situation that the usual health services get disrupted, including TB care services, and this kind of puts the whole effort and the whole energy that we put in to almost a zero level, and every effort gets wasted. So let us have a resilient health system so that such kind of disruptions, they do not really disrupt the health system, and the show must go on, that is the care services go on as smoothly as possible. Key message 4 is to end TB to strengthen health security. So TB is a social disease with medical aspects, and it has a lot of economic undertones to it, and that is why controlling TB is giving health security, because the burden of TB is so much that if we just take care of this one aspect of disease in our country, we are going to get enormous gains as far as our countries are concerned, at least. Mobilize whole of government and multi-sectoral action, which means that the not just the health sector but also the education sector, the sanitation sector, the urban town planning or the slum development, public works department, all food and animal husbandry, all these sectors can contribute and collaborate for TB, for ending TB. Deliver people-centered TB care, which is like need-based. That is, all those who are in need of TB care services, they need to be provided that care, and this demands that the community involvement is very, very crucial. The health workers, health functionaries, and even the general public should be coming forward to help each other to end TB without any discrimination, without stigma, and without misconceptions, and without any discrimination discrimination in terms of socioeconomic status or religion or the strata that you're coming from, region-wise, any kind of discrimination. So, how do we take leadership? So, this year's theme talks about leadership and empowerment. So, how do we take leadership for ending TB at the medical college level? So, we as every cadre for that matter, teaching faculty, the private practitioners who are teaching in a medical college, everybody can be a part of the national health program. I mean, they can support and collaborate with the national health program in research, in trainings, not just of the students and the faculty or the professionals as such, but also of the non-professionals, the general public. Then the residents and interns, right from basics like history taking, thorough history taking, thorough clinical examination, and even screening for the patients, and engaging themselves into operational research. So operational research is wherein you try to find out problems that you encounter in your day-to-day practice and try to find solutions by means of formally conducting a research. So I can give an example which Dr. Swati just told me about new colleague, and which I was a part of. That in Tamil Nadu, they have done a operational research on triaging of TB patient as to where to put them as inpatient or outpatient, and thereby they have successfully reduced many deaths. When I was working earlier, there we conducted training sessions for the nutritional rehabilitation center staff. We taught them to do a Montrose testing and even gastric aspirate collection, so that the SAMs, the severe acute malnutrition patients, were screened by taking gastric aspirates and doing an MT, so that they could be diagnosed. And that these health functionaries, paramedical people, they were actually trained and they used to do these tests as a routine. The students also can involve in thorough history taking, learning how to communicate with patients, and they can use this knowledge during their field visits and in the family adoption program and even in student research. So start from where you are and to whatever extent of leadership that you can take, and so some initiatives we can be collaborating, or we can be a part, we can be assisting the government. Something called as sub-national certification of TB, wherein there is award given to the districts and states, so we can help out them. And then there is 100 days intensified TB campaign, so we can be a part of such initiatives. So let us be kind of Durandar in our own ways and try to contribute to ending TB. So thank you so much, thank you for the opportunity.
Thank you so much, ma'am, for an insightful presentation.